For our report, we chose to explain how to identify bacteria Vibro Vulificus in a patient. Before we begin, it is important to note that microbes are everywhere, including the ocean. According to Ocean SI, a single liter of salt water has about 1 billion bacteria and 10 billion viruses. If you weighed out living organisms in the ocean, 90% of that weight would be from microbes.
Backstory. A 27-year-old American male had gone on a trip to Japan with his friends, and all was well until the 5th day they had been there. On the 5th day, they decided to go to the beach, and while messing around, the man tripped and cut himself on a sharp seashell and began to bleed. Deciding that the cut wasn't a big deal, he decided to go into the water.
We will now be going into the patient's symptoms.
Within 12 hours of going to the beach, he began developing the following symptoms: watery diarrhea, abdominal cramping, nausea, vomiting, fever, chills, and what appeared to be a skin infection from an open wound. This was only the beginning, because from this point on he began developing stronger symptoms. He still had a fever, but developed stronger symptoms such as redness all around the foot, pain, swelling, warmth, discoloration of the skin, and discharge, leaking fluids. Before we get into the severity, if you are sensitive to graphic skin infection pictures, close your eyes. This is what our patient's foot looked like after 30 hours. As you can see, it is very swollen, it is a different color, and it looks very painful. This is why it is important to diagnose very quickly before it becomes more severe over time. With that being said, before we did anything else, he was placed on an IV to rejuvenate the loss of fluids caused by the diarrhea.
Patient medical history. The patient's medical history was then reviewed. The patient was found to have liver disease, liver cirrhosis to be exact, which was caused by heavy drinking throughout the years. Due to the liver cirrhosis, antibiotics were unable to be prescribed until identification of the bacteria causing the infection. This is due to liver disease allowing bacterial infections to be lethal. Testing. In order to determine what was causing the infection, many tests were run. Taking a sample from the infected foot, isolation of the bacteria was done. Using blood agar-based plates, the colonies formed were gray or white. Identification of gram-negative or gram-positive was needed, which was done using a gram stain test. The gram stain test came back negative. Knowing that the patient was in seawater with an open wound gave indication to what possible bacteria may have caused this. TCBS medium was used to grow the bacteria. Certain Vibrio bacteria ferment sucrose while in TCBS, which would be indicated by a yellow color. The result came back green, which showed no fermentation of sucrose. This is in line with bacteria Vibrio Vulificus and Vibrio parahemolyticus. In order to differentiate between the Vibrio species, plentiful of tests were run. Growth in broth with NaCl and without NaCl. For broth without NaCl, the results came back negative, while the broth with NaCl came back positive, which indicated the bacteria needed sodium in order to grow. An oxidase test was performed, which came back positive, indicating that the bacteria produces a cytochrome C oxidase, which is used in the electron transport chain. This also indicates that the bacteria is aerobic. A nitrate test was also done, which came back positive. Another test which was done was the arginine dehydrolase test. This test indicates whether a microbe is unable to use the amino acid arginine as a source of energy for growth. This test came back positive, which indicated a change from purple to yellow.
We obtained this testing information from upmc.edu.
Final diagnosis. Patient identified to have fibrosis, which is caused by the bacteria Vibrio Vulificus.
We will now be going into the treatment that we provided for our patient. As said before, the patient was given an IV to restore their water loss. Treatment is not necessary for most cases of fibrosis, but because he has prior health issues, it was needed. When a severe infection is suspected, treatment should be started right away because antibiotics improve survival. Antibiotics are generally not recommended for infections with species other than V. Vulificus, but can improve survival in severe or prolonged illnesses. Fibrosis wound infections might require rapid medical attention. Some wound infections are serious and might require surgery. Our patient specifically was given third-generation cephalosporin with dioxycycline that is commonly used for Vibro infections. Unfortunately, the antibiotics were not able to fight off the bacteria due to him being immunocompromised. Infection began spreading, and in order to avoid spreading to other limbs, the decision was made to amputate the foot. By acting fast, we were able to avoid him losing all 4 of his limbs because of how fast this bacteria is able to spread throughout the whole body. We were able to find this information on the National Library of Medicine. We will now be going into the prognosis. Due to the severity of the infection, he was never able to fully recuperate, as he lost his foot. He was observed for a week after the amputation before being discharged from the hospital. It was heavily recommended to stop drinking entirely due to his prior history and liver disease. He was also told to avoid seafood and ocean water. Physical therapy was also given due to weakness after the infection. In order to cope with this loss of his limb, we offered therapy for emotional support. The occurrence of this should not be common if he is able to maintain a healthy lifestyle and stay away from the recommended foods and from alcohol. Also, because of his intense immunocompromisation, it is best to avoid going into warm, salt waters or oceans where these bacteria thrive. Even though 1 in 5 cases of Vibro Vulificus leads to death, our patient will not have to face that because we were able to catch the infection on time and stop it from spreading. That is the end of our presentation, and we thank you for your time.